I think that wound care really is one of the activities that we do that combines a lot of the training we have. It combines the basic anatomy, basic physiology, pathophysiology, patient education, training of the patient and the caregivers, manipulations, manual therapy skills with lymphedema massage. It involves putting devices on, it involves mobility training, it involves strengthening. It really is a very broad, encompassing field to work in. So what I'm doing now is I'm taking Megan's pulse in her foot on the dorsalis pedis artery. I'm using a handheld Doppler. I'm listening for the sounds. I hear 3 distinct sounds. The 3 distinct sounds tell me that she has good arterial flow, that there's not a lot of calcification in that particular artery. Before I put a compression wrap on Megan's leg, I'm going to do this test, and then I'm going to do a second half of this test. The second half of the test is putting a blood pressure cuff around the ankle and check the systolic blood pressure in this ankle. It's a terrific treatment for lower extremity edema. It helps the body to squeeze all the excess fluid out of the leg, which improves the ability of the arterial flow to get the nutrition and hydration into the cells that are injured, as well as removing all the waste products from the wounded area after the cells have done some of their repair work. I'm going to be laying the wrap on from the metatarsal heads up to just distal to the fibular head. I'm going to position Megan in a comfortable position. I put my locking wrap on, the foot in dorsiflexion. With this particular product, the first layer is primarily to even out the contours of the leg. I'm not wrapping it tightly. See how I'm pulling it and the whole wrap gets thinner? I'm not doing that. I'm just laying it on. I have to be careful when I lay it on, that I lay it on with an even amount of compression. As I go down, I can see that there's a line in the center. If I look very carefully, it may not show up on the camera, but there's a line here where I have 2 layers here because I'm doing a 50% overlap. And I see where the fibular head is, and I want to stop just distal to the fibular head because I don't want to cause any compression where the nerve comes around the fibular head. I don't want a lot of compression with this. It should feel very comfortable. There should be no discomfort when this goes on a leg, even a leg with a large wound. This should not hurt because we have the bandage over the wound, and that's padding it from any irritation from this material pressing against the leg. The real compression of this comes from putting the Coban on. Coban has a certain amount of extension, which means right now it's loose, so there's 0 extension. Right now it's 100% extension. That's as far as it can go. I put the Coban on with about 50 to 75% extension. When I do that, I get about 15 millimeters of mercury of compression. So putting a wrap on like this addresses the edema. It addresses the possibility of the dressing shifting. It keeps the dressing intact, protects it from external contamination through bacteria, dirt, just living in the world kind of contamination, as well as it keeps the temperature pretty regulated so you don't get a lot of cold or hot spells, so the cells that are working there can function at a higher level. And it helps to, as I said, maintain its own integrity, and it allows the person to mobilize, which is one of the things as physical therapists we want people to mobilize.